Today we're going to talk about spirituality. But I'm a physical therapist, so of course I'm not going to do any kind of a deep dive on any one spiritual practice. However, what I will say is there is tons of evidence out there that people that do engage in some sort of a spiritual practice do have better health outcomes. So why does that matter to me as a physical therapist? Well, it is important that if you are someone who does or used to engage in a regular spiritual practice before your mobility issue, that you can resume that practice in the positions that you used to do it. So whether you're someone that gets into cross-legged or what I call like lotus position, or gets down on your knees, or you go to a church where you get onto your knees in like a pew, I've worked on all of these different scenarios with different patients, and so I thought what I would do is make one video devoted to the mobility side of a spiritual practice, breaking down the steps and really giving you a progression for getting into praying on your knees or getting into a cross-legged position, getting that mobility back so that you can do that in a step-by-step progression that will meet you exactly where you're at in your recovery process. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injury, with the end goal of empowering you with as many tools as possible to take ownership of your rehab and your health, to live an overall more active, more mobile, pain-free, happier, healthier life. And before we dive into the progression today, there will be a handout that goes along with this video that will give you the step-by-step progression of how to get into kneeling and what I call lotus position, but you do need to be a member in order to get access to that. To learn more about our Bronze Monthly Membership Program and to sign up, visit www.rehab-hq.com. But enough about that. Let's go ahead and dive into the first position that we are going to do, which is getting into what I would call lotus position. All right, so the first position that we're going to tackle is getting into lotus position or cross-legged position or Indian style. Whichever name you prefer. The place that I think is the best place to start is sitting on a couch. So this is my couch, my makeshift couch, with your back supported where you can lean back slightly. So it is a challenging position to get into if you haven't done it in a while, because your hips are probably going to be a little bit tight. But what I will say, for those of you that have been like lifelong prayers, or you've done this your entire life, as I experienced recently with a patient who has done this, gotten into this position a million times in his life, is that you do have the mobility probably. It just, you kind of have to work your way back into it. So if it's something that you've done your whole life, don't give up, because it's probably, you probably still have the mobility to do it if you just put a little time into it and work on it a little bit. So back supported, start somewhat leaning back because it will make it easier. And then I would start with putting your just one leg up first. So whether that's your involved leg or your uninvolved leg, you just want to kind of lift it up on to the surface and then let your knee just drop out to the side. Now, if this is your uninvolved leg, it's probably going to be a little bit more flexible, so you probably will be able to get it in. And then, of course, you want to get it in as close as you can to your other leg. Now, full disclosure, I don't have good flexibility, so I'm not going to be able to get into the full position. But if you are someone that is really flexible and you're used to having like, you're like in full lotus where your foot is kind of on top, then of course, you know, you can kind of keep working that leg back, but we're just going to do one leg at a time. So you want to work that leg back and just hold it. Again, it's probably going to be easier to do this on your uninvolved leg than it is on your involved leg. All right, and then hold that for about a minute. And then once you get done with that, put that leg back down. And then if this is your involved leg, use your uninvolved arm to kind of pick that leg up. Now, my suggestion is that you don't try and get the knee out to the side to start, because that position is a little bit more painful, I've noticed, for some people after a stroke. So just bring your foot up as much as you can onto the couch or the support surface that you're on. And then once it's up there, just slowly let it drop out to the side. And if it doesn't go all the way down, that's okay. Just take your time and be patient. Remember, if you're someone that did this your entire life, you probably will get back there. You just have to kind of be patient with yourself. And because you're slightly leaned back, which is probably not how you used to do it, that does give you a little bit more room to play with as far as getting your foot up. So if you really can't do it, I recommend just leaning back a little bit more. And then as you work that foot up, now this is kind of hard with the involved leg, but if you can, try and get that foot back up onto the other leg and just hold it. Again, I'm probably not going to show you how to get into the full position, but if you've done it before, you're going to kind of know how to get both legs up. And then once you feel like you've got that flexibility in both legs, I would go back to putting the uninvolved leg up first, and then just kind of start working the other leg up. So I'm going to modify it a little bit because I can't do that with this foot on top of the other foot, but I'm so impressed by my patients that can do this. But then, and maybe you can't right now, but maybe you could before. But if you can't, just get your foot so it's not on top of your other leg, and then bring your involved leg up. So you're just going to sit like this. Remember, I do think it's harder if you rotate the leg out. I think it's easier if you just try and bring that leg up first and then kind of start working the foot over and letting that leg fall. Remember, it doesn't have to be pretty. You're just trying to get that mobility back in your hips so that you can do this again. And you want to start slightly leaning back for this one. Don't forget, that's super important. You want to set yourself up for success. So again, what I found with a patient that I worked with recently is it was much easier to get the uninvolved leg up first and then bring the involved leg up and then let that leg rotate out. So up first and then rotate out. So that is step one. And then next, you're going to work your way down onto a low step. And then from there, you're just going to start in a squatting position and then just kind of cross your feet. So you're just going to cross them a little bit and then just let your legs fall out to the side. Now, because your bottom is up a little bit and your feet are down a little bit lower, now we're going to work on actually the sitting up part. So you're just going to sit up and just lean forward. Hold that for a minute. And then lean back. And again, lean forward. Hold that for a minute. So you can see you don't really need to have the feet all the way up yet. Remember, set yourself up for success and set some realistic expectations so that you don't get frustrated. You're just going to lean forward. And back. And then from here, you might want to try just getting one foot up and letting that leg drop down. And then switch and get the other foot up and then let that leg drop down. But definitely sitting up on something is going to make this a lot easier. And again, I cannot stress it enough. Set yourself up for success. But then from there, once you get good at that, and you might have to do this for a while, you can try bringing the other leg up, which I can't do, so I'm not going to show you that. And you'll just have to experiment whether you want to bring your involved foot up first or your uninvolved foot. I would try it both ways. There's going to be one way that's easier than the other, and I promise you, if you stick to it and you used to do it before, you can get back to it because you probably have the range. You just need to work on it a little bit. But that is it for that. Let's go ahead and move on to the next position, which is going to be prayer position. All right, so let's say you are someone who likes to get down onto your knees in a prayer position. Well, I would say for those of you that are in that category, the most important thing is the actual position, not necessarily where you do the position. So the reason I say that is I recently did this with a patient and thought that it was completely out of the question to get down in a traditional. What she liked to do was like on her knees in a prayer position. So we just modified it so that she did it in her bed. And, you know, I still think there's a lot of value in that. Of course, everyone's spiritual beliefs and spiritual practice and the reason behind why they do things is a little bit different. But I do think that if you're someone you get a lot of your fulfillment out of your spiritual practice from getting in that position, it might be beneficial to just be open-minded about possibly just doing it on a bed versus doing it on the floor. So that's what we're going to go over first, is how to get into a prayer position in your bed. So you're going to start just laying on your back. You are going to start on your stomach, rolling towards your stronger side if you have a stronger side. Once you roll onto your stronger side, you're going to use your stronger arm to kind of prop yourself up and fall to your stomach. Once you're on your stomach, you want to use your stronger arm. You can use both arms, but definitely kind of get more of your leverage on that stronger side of your body and just push yourself back. Now you will see I do have a wall back here. If you can put your headboard or something down by your feet end, for those of you where your leg just always wants to shoot out, this might help to stop that. Like as you move back, your leg's not going to keep shooting out straight because it's going to hit the wall. And then to your knees. And then from there, you can just push on up. So that is method number 1 in your bed. Method number 2, for some of you, you're not going to be able to get your knees to bend when you're all the way on your stomach. And then in that case, I would say use your stronger leg, which this is still going to be the stronger side, to kind of hook that foot if you can and kind of bend that foot up. Or you can start on your back and kind of, some of you already know how to do this, kind of hook that leg to get that leg up and bend it first before you roll. And then you're just going to roll to your side. Again, stronger side is facing down. Prop up on that elbow if you can. Again, this is one of several options. Push that arm straight. We kind of call this side sitting. Now, this is valuable for those of you where your leg just always wants to shoot out. Sometimes, if you can get it bent up really, really far, it's helpful in maybe not having it shoot out as much. And then from there, and again, some of you are going to be able to do this, some of you aren't. You're just going to have to try a few different options. You want to just push yourself onto your knees. So we're going from side sitting to leveraging your body weight over your stronger arm and pushing yourself back. And that is option number 2 in bed to get into prayer position. All right, now let's say you're someone who absolutely positively wants to do this on the floor the way you've done it for your entire spiritual practice before you started to have some mobility issues. Now we're going to go into a few different ways to get into that prayer position and kneeling on the floor. First one is you're going to use your strong arm and you're going to leverage your body weight over your strong arm. Now, I would practice this a few times of just leveraging your weight over your strong arm and pushing your butt up. So leverage your body weight over your strong arm and try and just push your butt up. We're just doing like a little bit of a kind of like a modified sit to stand. The thing we're trying to learn in this stage is just how you can leverage your body weight over one arm. So leverage your body weight over that arm and push. Leverage and push. Now, once you feel like you can get pretty good at that, again, this is your stronger arm, or your stronger arm and your stronger leg. Kind of move the involved leg out a little bit. Tuck the stronger leg behind you. and gently lower your, remember, we're still leveraging our body weight over this arm. Lower yourself down to one knee, and then just kind of let that other leg, knee come back to meet it. And come on down. And then to get back up, leverage your body weight over this arm as much as you can. Push up. And then from here, everyone does this a little bit differently. Some people can bring their involved leg forward. If you can do that, then push. Remember, it doesn't have to look pretty. You just have to be able to get yourself back up to a higher surface so that you can stand up. And then just kind of, I'm going to show you what most people do to start. Just throw your weight over the bed so you can get back up into the bed. You just have to get to a higher surface so that you can stand up from this position. Remember, it doesn't have to look pretty. It just has to be safe so you don't hurt yourself, especially if you're someone where you found a lot of fulfillment in life by engaging or participating in these practices from before you had mobility issues. So again, it doesn't have to look pretty, just make sure you're safe and you don't hurt yourself. Okay, so that's one method. The other method is to do it from standing, and some people, they do have an easier time doing this from standing. For some reason, the legs just get a little bit tangled up when you try and do it from sitting. My suggestion is that if you're going to do it from standing, still leverage yourself over one arm, step the involved leg back, or the uninvolved leg backwards, okay? A lot of people have a lot of difficulty stepping that involved leg backwards, so step your uninvolved leg backwards, leverage yourself over this arm, lower yourself down to one knee, and then again, it doesn't have to look pretty. Throw yourself over the bed as much as you need to just kind of get that leg back to your knees and back down. Okay, so we did it from doing it in bed, which for some of you that might be enough, and it might give you that fulfillment and might complete you in that area of your spiritual practice. And then you just do it in bed. We did it from sitting kind of on the side of your bed, and then we did it from standing. But there's one other method that we need to go over, or that has come up in my in-person therapy sessions, and that is how to do it at church in a church pew. And so we are going to go over that as our final method that we're going to show in this video. All right, so this is my little makeshift pew, and let's first practice getting down to your knees onto kind of like one of those knee pads if you go to a church that has this type of a setup from sitting. Now remember, if everyone else is standing up and they're going straight down to kneeling, no one's going to notice if you just sit down on the bench first before you go to kneeling. And once you're sitting, my suggestion is that you take your stronger arm and you put it on the chair in front of you or the bench in front of you, and kind of do something similar that we did from the mat or our bed earlier. Is I would go down onto your stronger knee. So I would try and kind of get up a little bit on your stronger leg and go down onto that knee, and then work your other knee down so that you're down on your knees. Now, going back, I'm going to show you with this hand since this one's facing the camera. I would see if you can just kind of get your stronger arm down and see if you can get your stronger foot up. And again, it doesn't have to look pretty, but use your stronger arm and push with this leg and just kind of push yourself back over the bench. Again, it doesn't have to look super pretty. Remember, most spiritual practices teach not to judge people. So no one's judging you, you don't judge anyone, and just focus on doing your practice. And then the other method that might work, and actually with the person that we tried this with, this one almost worked just as well. I'm not really sure why, because to me this seems like it would be a little bit harder. However, for this person it seemed to work a little bit better, and that's to just go straight forward. Of course, your bench isn't going to tip like this chair just tipped, and just kind of aim your knees down, and then to come back up leverage your body weight over that arm and push your bottom back up. Now, the other reason I'm showing this in this video is that if it's something that's super important to you and it's something you've always done, get creative with how you could set something up at home to practice. You never know what you can accomplish if you just practice. One of the best things about just trying something new that maybe you don't think you can do is the amount of body awareness you learn and just kind of what you learn about how to leverage your body. So yes, maybe it seems impossible right now, but it's a great activity because for a lot of people it holds a lot of meaning, and our brains like to latch onto things that we feel are meaningful. So in other words, in order to learn a new movement, attaching it to something that has a lot of meaning for you in your life might make that brain rewiring go a little bit better or optimize it a little bit. So again, this is something that's super meaningful to you. I wouldn't necessarily write it off as something you're never going to be able to do. Maybe set up something at home where you could practice in your home. Now, let's go over a couple of methods from standing. So if you are standing, my suggestion is, and again, probably want to set this up in your home a little bit first, is that you try and leverage yourself over the bench, and I would go down to your stronger knee first. So try and keep your weight over your less involved leg. And again, try and leverage yourself over the bench in front of you a little bit. So this is my stronger side. Leverage myself over that leg a little bit and see if you can lower yourself down. In most cases, this is maybe even a little bit higher than most benches. And so obviously lower is probably going to be even a little bit better to be able to get that leverage. And then same thing, see if you can leverage yourself over. And remember, you just have to push yourself up high enough that you can push your bottom back over the bench. Okay, and then that is it for this video. I know it's not going to apply to all of you, but if this helps just one person be able to engage in their spiritual practice, I 1000% think that it was worth making the video. Now, obviously, I am someone who doesn't sit a lot in that lotus position, at least not without some type of a cushion under my bottom. So another purpose of making this video is that if you have a better option or some way or method that you have figured out that works for you to be able to get into some of these positions, I would love it if you would share those in the comments. Again, the comments are really where the gold is on this channel. It's you guys sharing your stories and helping others out in this community. So if you have a suggestion, please, please, please share that in the comments below. If you like this type of video and you want to see more videos like this, go ahead and hit that subscribe button, turn on that notification bell so that you will get notified every time I upload new videos. As a reminder, we do have a membership program. We have a bronze membership program, which gives you access to ad-free videos, gives you access to our Discord channel, and any PDF handouts that might go along with these videos. And then we have a gold membership program, which gives you access to an entire exercise vault of over 400 exercises. If you want to support this channel or learn more about those programs and how they might be able to help you in your recovery, visit rehab-hq.com. There you will find all the details as well as be able to sign up. If you want to get exercises throughout the week, head on over to Instagram, where I post 1 to 2 videos every single week just to add a little variety to your home exercise routine. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.